afternoon. I'm happy to be here to tell you about an exciting new product that was developed especially for the hyperbaric environment. The Altantis Barovent pneumatic mechanical hyperbaric ventilator was specifically developed for full-range hyperbaric chamber utilization. During the last 40 years, physicians have been desirous of providing mechanical ventilation for critically ill patients requiring hyperbaric chamber therapy. And they've had to rely on ventilators that would not provide adequate ventilation above 2 atmospheres, needed to be modified occasionally to operate minimally during hyperbaric therapy, may no longer be in production and have no spare parts availability. They have been known to fail mechanically during actual procedures and have never been cleared by the FDA for hyperbaric chamber use in the United States. Physicians, practitioners, and administrators must assume liability for the use of a non-cleared medical device if ventilation is used in a hyperbaric chamber. Current status of hyperbaric ventilation includes ventilators modified by manufacturers and ventilators modified by practitioners, both resulting in physicians and other practitioners assuming liability for informed consent from patients before using a non-cleared medical device in their treatment. And they take the responsibility to consult with their insurance carriers and internal risk management before using a non-cleared medical device. Major mechanical ventilator manufacturers spent serious time and effort researching whether it made economic sense to engineer, gain government clearances, manufacture, and market hyperbaric chamber-capable ventilators, and have come to the conclusion that the expenses versus the monetary returns are not justifiable. The hyperbaric market seems too small to them, yet the need and challenges remain. Several noteworthy physicians and their associated requested that we make an effort to produce such a device for the hyperbaric community because we're a very small company. We began the research and found that the hyperbaric community asked for a ventilator that had the following capabilities: developed specifically for hyperbaric chamber use, had minimal operational, technical output controls to make it semi-automatic, was capable of ventilating pediatric through adult patients, would provide full capabilities up to at least 6 ATA, was mechanically reliable, easy to maintain, and would be long-lasting, and certainly an FDA-approved device. The engineering process was developed using the desires of the hyperbaric community and deciding what mechanical components were best suited to the task, utilizing specific ventilator components with long-proven reliability. And to give you an example, the timing valves associated with this device are really the heart of the Altantis. And I've been using these particular valves for the past 25 years in all the ventilators that I've created. They have a mean time between failure of 20 million cycles. The FDA has never had a reported failure in any ventilator that I have ever produced. That's unprecedented by FDA standards. Special components to enable the ventilator to perform semi-automatically throughout the hyperbaric pressure ranges desired. And in addition to our company's rigorous engineering practices, we utilize the FDA mandated criteria for development and testing of acute care ventilators, which include recommendations from ASTM, FPA, and other recognized standards groups. The Altantis is pneumatically driven and built using proven, high reliability components to offer many years of trouble-free operation. Eliminates the risk of using electronics in a high oxygen environment and relieves users from the extensive safety protocols that might be associated with using electronics in that environment. The design of the Altantis enables the ventilator to perform semi-automatically throughout the hyperbaric pressure ranges of 1 to 6 atmospheres. The Altantis was tested with both mono and multiplace chambers, as well as laboratory simulation of chamber pressures utilizing both air and oxygen as the driving gases over a 2-year period of time. We spent over 2,000 hours of chamber and laboratory testing. The first live patients were adult pigs, and they were ventilated with the Altantis first outside a chamber, then later inside a chamber at pressures up to and including 6 atmospheres. These initial patients thrive both during hyperbaric therapy as well as after removal from the chamber and ventilator. This particular research group that we worked with had never had an animal survive because they didn't have a ventilator that would properly take care of them at those pressures. The Atlantis offers the assurance of a 510K cleared medical device. We received the 510K clearance and is now available in the marketplace. The FDA clearance of the Atlantis benefits the hyperbaric community by providing a fully functional solution that provides ventilation to any hyperbaric treatment scenario. The Atlantis eliminates the patient-informed consent standards statutorily required for the use of non-FDA cleared medical devices. This is particularly important in the use of a hyperbaric ventilator, as many of those patients requiring hyperbaric ventilation may not be able to give informed consent. This also relieves the practitioner of any requirement to inform their insurance carriers that they're presently using non-FDA medical devices in their practice. As we said, we designed the device to be used in both mono and multiplace chambers. I think we all know the indications. And in summary, at this time, the Atlantis represents the only FDA-cleared ventilator for use in hyperbaric chambers in the United States. It presents a contemporary and safe mechanical ventilator for the practitioner to use with a wide range of chamber pressures in either mono or multiplace chambers. Any questions? Yes.
Yeah, hi, Richard Moon from Duke.
Yes.
I have a couple of questions. One is, what is it that actually drives the ventilators? Is it the oxygen or the air? And the question relates to oxygen bleed into the environment. Second is spirometry. Do you have any way of monitoring the tidal volume?
First question is, we can give air brakes with the device. It's primarily to be powered by either air or oxygen, either of which flows through the device and onto the patient. What was the second question? I'm sorry.
No, the question related to oxygen bleed was how much oxygen bleeds out into the environment, which has an impact on chamber oxygen concentration.
Okay. The device itself doesn't produce any leaks in a monoplace chamber or multiplace chamber. If you're using 100% oxygen, then exhale tidal volume or minute volume would be what is leaking into the chamber itself.
So does all of